So I am Jen Rowry. I'm the Director of Advocacy and Engagement for Healthy Birthday Inc. And I'll tell you more about myself here in a minute. But before I get ahead of myself, I would love to let you know that this presentation is only possible because of the partnership with Covenant Health and with the Michigan Health Improvement Alliance through the Thrive program. We are thrilled to be in Michigan. It is a 14-county launch, and we are so excited to have you join us. So much good work and so many good workers are going to be here today. And I think that we'll all leave a little bit better. So I'm so thankful that you've joined us. Let's go ahead and talk about Saving Babies, a guide to talking to expectant parents about fetal movement monitoring. And again, a big shout out to Covenant Healthcare and to the Michigan Health Improvement Alliance through the Thrive program. As I mentioned, I'm Jen Rowry, the Director of Advocacy and Engagement for the 501(c) nonprofit Healthy Birthday Inc., which runs the public stillbirth prevention campaign, Count the Kicks. My email is there. I will also be emailing that out. You are more than welcome to interact with me as you have questions or potential ideas for partnership or growing our reach in Michigan, because we do want all expectant parents to have this information. Why is this important? Why is it important to me? So my background is in education. I believe knowledge is power, and much of what we do is providing education and tools and resources. And so I came to this work, honestly, because one of the founding members or moms of this organization is my neighbor, Carrie Biondi Moreland. And she was my neighbor when she lost her daughter, Grace, in 2003. This was the first time that stillbirth touched me. This is the first time I realized that it wasn't something just of my grandparents' generation. It's the first time I understood that I could be at risk of such a tragedy, and to see it firsthand was shocking. I did not know at that time that over 23,000 babies a year were born still in our country. I did not know at that time that stillbirth could potentially be preventable. I didn't know at that time that I should be kick counting. And so all that lack of knowledge, I am so thrilled for this campaign, because it is filling the gap where the gap was huge, and the possibilities of getting babies here safely is great. So I love to start our presentations with this really feel-good video highlighting our Count the Kicks app and the impact that a mom being informed and empowered to speak up can have. In this video, you're going to see the power of mom-to-mom sharing, and I feel like it does a good job of kind of highlighting the goal, where we're headed, and why we're talking today. So I will start it.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping. like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
We finally refer to that that effect that Ruby had as the Ruby effect. And Ruby indeed was responsible for saving more babies. We received stories within weeks of that. And now our app has been downloaded well over 180,000 times in over 140 countries. And we are making a big splash across the world. And Ruby was a part of that. So we'll circle back to some of the things you heard in that video. But let's talk about the definitions of stillbirth, miscarriage, and infant mortality so we can just level set, make sure we're all know and understand exactly what we're talking about, because this is a stillbirth prevention campaign and primarily focused, definitely fully focused on stillbirth. So miscarriage in the United States, these are definitions in the United States. Internationally, these definitions could be different, but miscarriage in the United States is defined as the loss of a baby before the 20th week of pregnancy. In contrast, stillbirth is defined as the death of a baby in utero after or from that start of that 20th week, after the 20th week to the end of pregnancy, whatever week that is. And so stillbirth can be further classified into early, late, and term. Most of our conversation today is going to be focused on that third trimester prevention effort. So the late and term stillbirths from 28 weeks to the completed weeks of pregnancy is where kick counting can really make a big difference. Now, in comparison to the number of deaths in babies, according to the CDC, we're losing over 23,000 babies a year in this country. Let me say that again. Over 23,000 babies a year are dying in this country because of stillbirth. That's 65 children or a school bus full of children every day in this country that aren't going to go home to their parents. This is a silent epidemic that is happening in our country, and we want to not only shine a light on preventing stillbirth, but the fact that stillbirth is significantly more prevalent than our society addresses, and therefore we keep our head in the sand a bit. So we want to shine a light on this so that we can address it and combat it and get babies home safely. So thankful you're here to do that with us. In contrast, we lose about 22,000 babies a year to infant mortality. That too is too many, but we hear significantly more about infant mortality in this country than we do stillborn death. And that's what we need to be talking about as well. You will notice that there are citations on the bottom of these slides. So all the slides are cited. We refer, national data is going to come from CDC Wonder, and we refer to evidence and science throughout. You're also welcome to go to our website, www.countthe.kicks.org, and check out our evidence page and the research and information that we use to create and share our campaign. So in this country, as I said, stillbirth is more prevalent than most people realize. In fact, it's 10 times more prevalent than SIDS, although safe sleep is something we talk about a lot, as we should. We want to save those babies. We also need to be talking about kick counting and stillbirth so we can get babies here safely. Every 1 in 169 pregnancies in this country actually ends, in stillbirth. Apologies. Racial disparities exist and persist to this very day. In fact, a Black expectant parent in our country is more than 2 times as likely to lose her baby to stillbirth as her white neighbor, friend, or counterpart. That means every 1 in 96 pregnancies for Black women ends in stillbirth in this country. For some states, like especially in the South, that number of loss can even be higher. Hispanic moms have a risk of 1 in every 199 pregnancies. Indigenous moms, 1 in every 138, so a very high risk group as well. White expectant parents have a rate of 1 in 204, and Asian Pacific Islanders have a rate of 1 in 233. That's the national average currently. Now, national data is behind. This is based on 2019. Why? Because that's the last data that the CDC has shared. From a national perspective. We do not know what 2020 and 2021 data looks like, but considering there was a pandemic, and that has impacted moms and babies. We are anecdotally preparing ourselves for stillbirth to be even a bigger issue. Michigan data, let's talk about what's happening in your state. And so this is the rate statewide, not just in the 14 counties that service area that we are serving, but the entire state has a stillbirth rate of 5.7. So that means that nearly 6 babies out of every 1,000 babies in your state is born still. If you want to break that down by race, you can see those numbers there, and you can see that your state is not an exception to the rule in those disparities that exist and persist in stillbirth. And if we were to save 1 in 3 at-risk babies in Michigan, like we are in the state of Iowa, that would mean 199 of babies would come home safely. Sadly, in your state, you're losing about 622 babies every year to stillbirth. And in the 14 county service area, you're losing 25 babies a year on average to stillbirth. So I said Iowa, right? And Iowa is where our campaign started and was infiltrated and saturated first. And so it is kind of a measuring stick. And in 2008, our founders, 5 women who experienced the loss of daughters and found research and evidence to create this campaign, did a soft launch of Count the Kicks. And you can see that represented here. So this data goes from 2003 to 2021. It is information from CDC Wonder through 2019 is where you see, but we've actually added Iowa's data. So national data, last data point is 2019. This red line is the national data point. The blue dots are the Iowa stillbirth rate over the course of time, and the dotted line shows the downward trend in our stillbirth rate in the state of Iowa. Of course, we do look at averages because there are outlier years. Iowa, being a low birth rate state, could have a syphilis outbreak and or a pandemic that could really impact those stillbirth numbers. And so we do have outlier years. But in the first 10 years of our campaign, there was a 32% reduction in stillbirth in our state. And for Black women in the first 5 years, we had a 39% reduction in our stillbirth rate. This is what we want to bring to Michigan. This is what we want to bring to the country. If we were to save 1 in 3 at-risk babies across the United States, that would be 7,500 babies that could come home to their families and stillbirth could be diverted. Research indicates that a minimum of 25% of a conservative, very conservative numbers, 25% of stillbirths are preventable, but we know that could be even greater. Why are there such large disparities? Coming back to those disparities we just mentioned. Well, based on the research we've looked at, there are some contributing factors, and I don't believe they should be shocking to you, but research points to the following causes for these disparities. Systemic racism, which creates an environment of toxic stress, where essentially being an African-American woman in a systemically unjust society creates real and pervasive health issues. Things such as the concept of epigenetics, where physiological variations can literally occur temporarily in the DNA to cause those that predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure, which are all linked to maternal stress. Access to healthcare and timing of that access. So getting the healthcare, but when you're getting healthcare also matters, especially in pregnancy. Hopefully you go into a pregnancy healthy, but certainly in that first trimester, prenatal care is when we need to be making sure women have what they need. So experts say Black women are less likely than other races to receive early treatment for the conditions that gestational diabetes and things that maternal stress causes. That could be because they have a barrier to access to healthcare. There are socioeconomic barriers that are prevalent, and we know based on research that a college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So we want to change that, and I know you want to change it too. So what's Count the Kicks doing to try to knock down barriers and increase access, reaching those that are being marginalized? Well, we try to knock down barriers with language. Our app is currently in 14 languages, and that continues to grow as we find partnerships that require demographics to be reached. We have culturally appropriate educational materials. We have videos, printed educational materials, and FAQs in multiple languages. We have staff that's specifically looking at our work and helping to reach communities in need. We are always looking for funding opportunities to reduce those racial disparities. We are an inclusive organization with 100% board and staff training on anti-oppression and structural racism. And we use the lived experiences of people of color to inform our programming and our work. We hold focus groups. We work with community-based organizations. We do whatever we can to build those partnerships and allow the boots on the ground, the trusted members of communities to go into those communities and share this information. And we work outside the traditional healthcare system. So yes, OBs definitely and nurses need this information, but also home visitors and WIC workers and food bank workers, anyone that is intersecting with an expectant parent that has this information to share is somebody we want to reach. And there are many great organizations out there that we are partnering with that are not just in a hospital system, although those partnerships are vital as well. We are a research-based and evidence-based campaign. In fact, where did this come from? So I mentioned that we were founded by 5 Central Iowa women who lost daughters, 4 to stillbirth, 1 to infant mortality. And really these women were brought together out of their loss to grieve together through shared family friends. What they discovered is that they were all told that stillbirth just happens. There's nothing you can do about it. It's as rare as being struck by lightning. And yet they found one another and had lost their daughters all in a very short amount of time in a small geographic area. And they're like, I don't think this is true. What they realized is that nobody in Iowa, or really across the country at that time, was doing a good job of collecting information on stillbirth. If we don't know what's happening, we certainly can't understand why it's happening. And if we don't have those 2 things under control, the what and the why, how do you prevent it from happening? So they were responsible for passing the first stillbirth registry in the country here in the state of Iowa with then Senator Tom Harkin. After that, they were at a conference presenting on this stillbirth registry, which ironically led to other states getting a stillbirth registry, and even a national stillbirth registry was created out of their work. And when they were at this conference presenting in Washington, D.C., they sat in on a presentation on a study done in Norway, where researchers took a cohort of women, educated them on tracking their baby's movement in the 3rd trimester, learn their baby's normal, and to speak up to their care team if they noticed a change in that baby's movement pattern. At the same time, the providers were the educators. They were sharing this information, but they were also listening to concerns and acting upon those concerns by practicing good investigative practices. And so what the result of that research was that 30%, there was a 30% reduction in stillbirths in that cohort of women that was educated to track movement and to speak up if they noticed a change. And that's when our founders, Janet and Tiffin, 2 of them at the time, said, that's it. They got on a Southwest airplane to come home, and literally on a Southwest napkin, the concept of Count the Kicks was born. And they all said, we don't want any other family to experience this. If we could save only one baby, only one, it would totally be worth it. Well, they've saved significantly more than that. And so we are here to share this information, but I want to draw your attention back to the slide. So this study was also part of the study was Dr. Ruth Fretz, who continues to sit on our medical advisory board, is a trusted member of ACOG, professor at Harvard Medical School, and was a practicing OB at the time. And she says this: tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. And that's Count the Kicks. And so let's continue to learn. We've also been named a best practice by the Association of Maternal Child Health Programs after they did a thorough scientific review. We know that they're important. They're a leading maternal health association that's basically the membership organization for state health departments. And we are thrilled to have their support and partnership. We also know that movement matters. When we look at the CDC's Hear Her campaign, one of their 15 urgent warning signs for pregnant people is a change in baby's movement. And so they are continuing to ring the bell about the importance of tracking and speaking up if you notice a change. One barrier we sometimes face is that providers will say, or individuals in the healthcare team or profession might say, kick counting is going to increase the anxiety of my clients. It's going to cause them to panic. It's going to cause unnecessary phone calls and visits. So this has actually been studied. As you can see, there are studies cited on this slide. And what they're basically found is this is not true. So it says one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women and actually prevents unnecessary visits. We had our own study done. We took data from our app users and shared it with the Harkin Institute and Des Moines University, and they did a study on our app users. And what they found is that this is aligned with all the other research that's out there regarding this anxiety. 77% of app users actually reported feeling less anxious because they were in tune with their baby, they were in tune with their body, they were able to trust their instincts. They also had data at their fingertips and knew when it was important to speak up and when things looked to be okay. Another benefit is 84% of our app users stated that regular tracking was actually associated with feelings of bonding with that baby. Spending time each day with that baby, getting to know their patterns, getting to know their personalities, perhaps dreaming with them, connecting. A partner can help kick count, siblings can help kick count. And that bonding carried into the postpartum period is so vital and to improving those that experience for mom, but also for baby and potentially preventing childhood ACEs or adverse childhood experiences. Another thing that the study stated is using an mHealth app, the Count the Kicks app, to empower mothers to monitor their baby's fetal movement. The preliminary research shows that the mHealth app actually increased an awareness of a change in fetal movement and thus led to a reduction in stillbirth. So fetal movement monitoring has additional benefits. We also believe that when a woman is regularly monitoring and in tune with her baby and her body, it could help reduce the preterm birth rate. Here's an example. My own executive director actually was a newscaster, TV news reporter or journalist here in the central Iowa area in 2008 when Count the Kicks did a soft launch. Guess who the reporter was that did the story? She did the story on Count the Kicks. About a year to the day later, she was 30 weeks pregnant. She had the knowledge of the importance of monitoring movement and speaking up if she noticed a change. And that's exactly what happened. At 30 weeks pregnant, she noticed a change in her son's movement. She addressed that concern with her doctor, who rightfully had that further investigated. And unbeknownst to Emily, our executive director, her body was in preterm labor trying to deliver her son Hayden at 30 weeks, which has many risks, as you know, including death and learning disabilities and other health issues, and a very expensive stay in the NICU at the least. And so they were able to intervene quickly, and through bed rest and medication, she was able to carry Hayden into the 40th week of pregnancy. He was born healthy, didn't spend a day in the NICU, and is here today as an active, I believe he is now turning 14 soon. So that is an example of how being in tune with her body actually intervened in a situation where if she would have waited for her body to tell her this instead of her baby, who knows if they would have been able to stop that delivery from happening early. Fetal growth restrictions can be identified earlier. When a baby's not getting what they need in utero, it shows up in their growth and it shows up in their movement. And usually there's a slow decline of movement over time when a baby is not well. And so if mom is speaking up that there's a change or baby's not moving well and that's investigated, hopefully we can find the issues and address those issues in the safest way, whether it's in utero, keeping baby in utero and monitoring, or delivering baby to get them here safely. Also, please know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births. So a mom who delivers a stillborn baby is more than four times more likely to suffer a health issue herself. Let me give you an example of how we think that this Count the Kicks is not only a solution for monitoring or for saving babies, but also potentially saving moms. We have a baby save story out of Ohio. Mom was fourth time being pregnant, fourth time mom, nurse practitioner. So she has access to good health care. She has a high health literacy. She is knowledgeable about her body and being pregnant. She was counting her kicks using the Count the Kicks app daily. She woke up one morning in the 38th week of her pregnancy, so the end of her pregnancy, and just didn't feel 100%, but she attributed that to being tired. She was a mom of 3 small children. She had a full-time job and she was very pregnant. So she dismissed it. Went about her day, actually had that day off, got a massage, realized at the end of that massage that her son wasn't moving like he normally would. And he sure should have been moving after that massage. Came home, said something to her husband, who said, "You need to call." So let me stop here and say, all of you that are intersecting with expectant parents have a very important job. You need to make sure that expectant parents have a voice and that they know it's okay to use that voice. You literally, in conversations, need to give them permission to share their concerns, because what women may tend to do is they don't want to believe something's wrong, so they may stay in denial. They may not have the confidence to speak up. They may dismiss their own instincts, and they may not want to be a bother, and that is a problem. We want moms to know that hospitals are open 24/7. They're there to serve you, and that if you have a concern, to trust yourself, trust your instincts, trust the data that's in the app, whatever it is, and to speak up. So in this case, husband was the extra voice or nudge that mom needed to get that to the doctor to have things investigated. Guess what? Baby was responding to mom's health crisis. Mom's blood pressure, unbeknownst to her, had gone off the charts. She had never had blood pressure issues inside of or outside of pregnancy, so she wasn't expecting it. When she got to the hospital, the risk of stroke for mom was high. This risk of maternal morbidity and mortality existed for her, and baby's movements what triggered her to speak up. Both mom and baby got here safely. Baby got here safely. Mom is fine. It's a win-win. We actually have studied this. We've just released a white paper, and the link between stillbirth and maternal mortality and morbidity, firsthand accounts from American women. And what's horrifying in this study is that in the United States, the rate of maternal morbidity and stillbirth is higher than other well-resourced developed nations. Why? Because we're not doing the research, we're not collecting the data, and we're not taking the actions we need that is happening across the seas from us. And so we need to be talking about stillbirth so that we can be doing the work of researching and preventing stillbirth. As I mentioned, research shows that the risk of severe issues is much higher for a mom who delivers a stillborn baby than with live births. And according to one study, more than 15% of maternal deaths within days of delivery occur in women who experienced a stillbirth. So if you are providing support to postpartum moms, it's especially important that if a mom has delivered a baby stillborn, that she receives medical attention and care. I have reports from lost moms across the country that said that they weren't offered postpartum visits, or they were told they didn't need to worry about a postpartum visit. It's actually essential that these women's health be tracked, even more essential than a normal delivery. But I think we all agree that every woman who's delivered a baby needs that postpartum care and observation and support. So let's talk more about Count the Kicks, which is why you're here today. What is it? It's a stillbirth prevention campaign, which hopefully you know and understand. It is evidence-based, and it is here to educate expectant parents on the importance of tracking fetal movement, both through the free mobile app we're going to talk about, the Count the Kicks app, and free downloadable kick counting charts that are can be found on our website, www.countthekicks.org. Our campaign empowers moms to speak up to their providers if there's a concern. So take note of the colors of these materials. Our founders did not want to create a fear-based campaign that put guilt, shame, responsibility, and basically use fear to manipulate moms to count their kicks. They wanted it to be mom-friendly, mom-focused, not medical looking, attractive, appealing, bright colors. And that's exactly what our campaign has created. It's meant to be educational and empowering. So why does movement matter? Movement matters because it is the one very important way that a baby communicates before birth. A change in a baby's movement can be an early warning sign, and sometimes the only warning sign that a baby may give when it's in distress. So there are really three types of movement changes that we are going to talk about today. One is a decrease in fetal movement, or a baby stopping movement completely. That is probably the most common complaint or concern expressed by expectant parents, or things that they noticed after delivery, even of a stillbirth, is that like reduction or slowing down of baby. Baby's movement may actually become softer or weaker. Think back to the video that I just shared where mom Emily Ecoff says, not only was baby moving less, but her movements felt softer, more subtle, not as strong. So that is the decrease in strength of movement. And then the third warning sign with movement, and that a lot of people don't know about, but is a big red flag that mom needs to get checked out right away, or pregnant people need to get checked out right away, is a sudden wild surge of movement, like described almost as like a violent surge of movement, where baby's moving so much, belly is visibly moving outside, mom can see that on the outside. And so that is a warning sign that baby is seriously in distress and needs to be seen. Why is movement how babies communicate? Think about you and I, right? When I'm feeling good, I want to go out for my morning walk. I want to eat food. I want to exercise. I want to go to work. I want to spend time with friends. I'm active. When I don't feel well, I want to conserve energy. I'm tired. I'm weak. I want to go to my couch. I want to rest because my body is not feeling up to par. Babies are just like you and I. When they are not feeling like themselves, or there's something prohibiting them, their signal is going to be through their movement. Just like I can see my living children go to the couch when they should be out playing in the yard. So since kicks matter, let's start counting. When should a mom start counting kicks? Well, in a healthy pregnancy, 28 weeks gestation is the beginning of the third trimester, and that's when we would want mom to count the kicks. However, if this is a high-risk pregnancy, we would want to start that kick counting at 26 weeks. Why is this our advice? Because research indicates that's when baby has established a consistent pattern of movement that mom can feel and track. So we want that consistent pattern. We also want mom to be consistently feeling that movement. Now, moms can report feeling movement differently. If they have an anterior placenta, they may be a little slower to feel movement, but they should eventually feel movement. And if mom is active and baby is healthy, she may find that she's noticing those kicks sooner, but we want that normal pattern to start. So that's why we recommend, based on research, that third trimester counting, or 26 weeks, a little bit earlier than that if you're high risk. What counts as a kick? Rolls, kicks, jabs, pushes, anything except for hiccups, because hiccups are involuntary movements. So that's what mom should be counting. So we want mom to be in tune with her baby and her body. So we want them to track movement every day. The Count the Kicks app is free, and where mobile technology is not available, we have downloadable kick counting charts in several languages: English, Spanish, Haitian Creole, Navajo, and Swahili, on our website that you could go to and print today. So they are going to count their kicks every day, preferably at the same time of day. They're going to learn their baby's patterns, and they're going to find a rhythm, and they're going to count their baby's kicks every day. And they're going to measure how long it takes their baby to get to 10 movements. And after a few days of doing this and recording it, a pattern will emerge, and they will be able to see about that average length of time it takes baby to get to 10 movements. Once they have that average, they'll notice if there's a change, if baby slows down, or if baby's really, really active. They're going to be in tune with that and know when to speak up. Of course, our Hallmark tool, it's free. It's available to you in Apple and Android stores. A rare opportunity where a presenter will say, feel free, pick up your cell phone. You can listen while you download the free Count the Kicks app. I would love for all of you to do that. If you're intersecting with expectant parents, you need to know how to use the app so that you can educate them on how to do so and help them learn how to count their kicks appropriately. As I mentioned, the app is in multiple languages. Those are listed here. It is free, and also some other features that I think are wonderful about the app. A user can restart their session. So say they start a session, toddler has a complete meltdown, they have to step away, handle life, as we know can happen. Preferably they're laying down and relaxing and just kind of really enjoying the experience, but sometimes that does not always happen. And so they can restart that session, or they can delete a kick if they accidentally hit the button twice, or if they have their the sibling of the baby helping count the kicks and too many buttons get pushed. So there is a lot of ability to update that information so you have the accurate information recorded in the app. You can set daily reminders. We're all busy. We all need reminders. You can review your kick counting history. You can download and share that history with a provider, family, friend via text or email. And you'll notice here on the screen, on the far top right corner, you can see the tapping of the footprint. So there's a clock. Once you tap the footprint once, the clock starts with the time. When you hit your 10th kick, the time stops. That is how long it took your baby to get to 10 movements. And over the course of 5 to 7 days, you'll be able to establish a graph. So in this graph, it looks like it takes baby about 15-ish minutes to get to their 10 movements. And that is a very visual way for expectant parents to see the trend of their baby's kicks. You can also count on an Apple smartwatch. You can track future pregnancies on the same profile. You can count the kicks for twins. You can have multiple devices registered to your account. So if you have an Apple computer, an iPad, an Apple Watch, and an iPhone, all of those can be synced together. So lots of ways for you to access this information. The other thing that's been added based on research, as I've mentioned before, strength of movement matters. And so once mom gets done with a kick counting session on the free Count the Kicks app, she will then be cued to answer the question of how strong she perceives her baby's movements to be. And so fluttery, number 1 is like light, fluttery movements, to number 5 is fierce. So they will rate that. They can even put a note in there, like this note says, baby felt strong like normal. And then they will establish a chart. So they're perceiving what it feels like when baby does move and is well. So they might be able to determine then if that movement is changing, not just in pace, but in strength as well. Here at the far right-hand side of the screen, you can see what a graph might look like when a baby has changed their movement pattern. So here is the chart for how many kicks it takes to get to 10 minutes. And what you notice is that it took a lot longer all of a sudden in this session. So baby has appeared to slow down. At the same time, mom's perception of movement, or the pregnant person's perception of movement, is that it's weaker than it normally had been. So baby's slower and weaker. That's a real visual way for mom to realize, I think I should go in and get this checked. That's a concern. The app has video capabilities. There are many resources and information, much information on there to help inform them about the app, how to use it, and baby saves, why kick counting is important, how to count the kicks, etc., FAQs, and beyond. Also, we have this free and I think important resource. We want to impact the social determinants of health. So during pregnancy, we know that mom's health can be impacted if she doesn't have proper nutrition, if she doesn't have a way to get to work, if she has additional stresses. And so if you go into the Find Resources tab of our app, the user can literally put in their zip code and find free and low-cost resources that might impact things like access to food, housing, transit, health, money, care, education, work, etc., legal help. And so they can actually find programs that are in their area that could serve or help meet their needs. If you put your zip code into the app at this time and notice that there's a great organization that's not listed, email me, let me know. I'd be glad. This is a living and growing list. I'm going to show you a quick video on how to count the kicks. I think it does a fine job of showing you the app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So Count the Kicks. Let's talk about how to integrate it into the work that you're doing. Many of you are already serving expectant women and doing amazing things. So how can you integrate our program into the work you're doing? Before we get much further though, I think it's really important to know and understand that health literacy is actually one of the strongest indicators of a person's health status. Their access to healthcare, their ability to advocate for themselves, their ability to navigate a very complex system, all of those things and their understanding of their body and is all very important. So having a healthy dialogue with those that you serve is a key to prevention. I'd like to suggest 5 ways to improve the conversation for you to consider. First of all, be equitable. Avoid assumptions and provide all expectant parents, no matter race, gender, religion, socioeconomic status, sexual orientation, marital status, or education level, the same information and interaction. Whether a client has a GED or a PhD in astrophysics, they need to know about kick counting. Don't assume they will, especially if someone's never been educated to know that this is important. No matter their education level or who they are, they won't know to do it. So make no assumptions. Go into every single conversation you have, assuming they don't know and understand, so that you provide them the tools and resources they need. If they already know it, great. You've just reiterated it. You've put more proof in the pudding that they should do it, and you're further down the path. But if they've never heard of it and you don't have this conversation, there's going to be a real gap in their ability to understand when to speak up. Make sure you listen and you learn. Ask strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. I can't reiterate enough, like working with women who have lost babies across the country, how important this particular piece is. The information in the room is vital. The attitude of the individual serving them, the healthcare team, is vital. If you ask closed-ended questions, you will learn nothing and maybe not what you're trying to learn. So an example of a poor question, a closed-ended question on kick counting: is your baby moving? Well, unless they really don't feel any movement at all, they're going to say yes. And because they said yes and you moved on, they're going to assume everything's okay. But is their baby moving normally? Do they know what their baby's normal is? Is their baby in trouble? How would they know? What you've also done with that closed-ended question is not only stop the conversation and maybe falsely reassured mom that since you moved on, everything's fine. You have potentially said to them, it's really not that important because we didn't stop and talk about that. So think about open-ended questions you can ask. What is your baby's normal movement pattern? Are you counting your baby's kicks? What are you feeling? How often do you feel, baby? Answers that don't take a yes or a no, and listen and learn from them, understanding where they're at with this important information so that you know how to educate and encourage. Be clear and concise. Avoid long and complex explanations and medical terminology. Consider everyday vocabulary. Just make it as straightforward and clear as you can. Be honest. Speak the truth while still practicing empathy and compassion. Stillbirth is a risk factor in pregnancy. It just is. And just like we wouldn't deny telling women that breast cancer is a potential hazard to being a woman, we would not say don't go get mammograms or try to have early detection or do preventative measures. We don't want to do that in pregnancy either. And we talk about lots of risks in pregnancy. Stillbirth should not be the exception. It should be the rule, and kit counting should be a standard of care. Make sure to reteach. So if a patient displays confusion or a lack of understanding, make sure to correct and clarify, and then also find the extra supports they may need. So if someone is simply struggling, you can be an important part of filling the gap for them. Talking about with stillbirth with expectant parents. Some people might say, I don't want to scare mom. Well, pregnancy is full of risks that you've already talked to them about. They're not eating sandwich meat. They're not changing the cat litter. By gosh, they better take their folic acid or the baby's brainstem might develop. Every 7,000 babies is born with Down syndrome. You need to take a gestational diabetes test because you may get gestational diabetes, which could be bad for you and your baby, et cetera, et cetera, et cetera. We are already educating women about the risks that they have during pregnancy. They deserve to know that stillbirth is a risk and how important it is to be in tune with their baby or their body. It is for you to share and for them to choose how they're going to take that, but it's still very important that they're spoken to. Stillbirth just happens. There's nothing we can do about it. I've already addressed that. Movement's an early warning sign. Research shows that we can save many of these babies from preventable stillbirth, and we can do that through education and empowering the voices of those carrying babies. Her baby is always active. It's not a concern. I have an ambassador that speaks to this slide because she will say her daughter Lydia, that Liddy is her nickname. Liddy was her most active out of her 4 pregnancies, extremely active baby in utero. Baby was completely healthy. Baby died of a cord accident. Anyway, Liddy was extremely active. She talks about how Liddy was so active that she learned to dismiss her movements. She stopped noticing them because she was so used to them, and she wasn't tracking. So she didn't notice when there was a change in Liddy's movement until she had completely stopped moving, and at which point it was too late. And she always has been haunted by the fact of, if I would have known, would I have been able to intervene? So an active baby can have a cord accident, a placental abruption, and they can be sudden. Even active babies need moms who are tracking their normal so they will notice a change and be able to speak up. She's almost at her due date. Well, the risk of stillbirth actually increases as a mom approaches her due date and really increases as she exceeds her due date. So keep that in mind. You need to have this conversation with moms that have lost babies. You still need to talk about kit counting, but now they are high risk. You need to have that conversation at 26 weeks. I encourage each of you that has a chart or information on an expectant parent that you're going to serve, that you read that chart before you walk in the room, so you know and understand what trauma, what loss, what experience that person has, so that you can address and approach that conversation empathetically, but more importantly, that you have the conversation. Please call that baby by its name. It's a member of their family. One of the biggest fears of individuals that lose babies oftentimes is that that baby would not be considered important enough to remember. So be empathetic, stay away from fetal demise and other medical terms that would be triggering to those individuals, but still have the conversation without applying guilt. Has anyone ever talked to you about kit counting? And so we'll just continue the conversation from there. Not, did you count the kicks with your baby, or why didn't you kit count, that type of thing. And I'm sure you're all doing wonderful things and having these wonderful conversations the right way. So this is important. The next couple of slides are really important because these are the common myths. I think many of them have been passed down generationally from pregnant people to pregnant people, or have been spread across the internet and social media, and they can be very, very harmful and dangerous into preventing expectant parents from speaking up when they do have a concern, and getting the care that they and their baby may need. So the first one I have already addressed. My baby is always active, so I don't need to count the kicks. False, false, false. Only those experiencing a high-risk pregnancy should pay attention to their movement. Hopefully at this point in the presentation, you would also say false, because we know that all expectant parents deserve access to this information and need to learn their normal. Many of the women that have experienced stillbirth will say, I was not a high-risk pregnancy until my baby died, which then puts them into that category. So all expectant women deserve this information. My baby should get 10 kicks in 2 hours. False. This is actually outdated information. Every baby is different, and the recommendation is to expect 10 kicks in 2 hours is no longer what research is indicating. Current research indicates moms should work to understand their baby's normal amount of time each day it takes to get to 10 movements. So even amongst moms comparing pregnancy to pregnancy, it'd be like you comparing, if you have living children, comparing one child to another. That really doesn't work. Every baby comes uniquely and differently, including through their movement patterns. So a mom that had a baby that is super active, their next baby might be slower in their movements, but that's normal for that second baby to be slower. Not good to compare baby to baby, not good to compare pregnancy to pregnancy. And so we want to learn what's normal for that baby, so we'll notice when something changes for that baby. I can just use a Doppler device to monitor my baby's well-being. No, 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 we do not want untrained professionals using poor technology. They may be hearing their own heartbeat. They may not even know how to find baby's heartbeat. And we also know that heartbeat is one of the last warning signs that baby's in distress. You have a heartbeat until you don't. So if baby's heartbeat's being impacted, they're a real sign of distress. We don't want women reassuring themselves falsely with a Doppler. We want them paying attention to movement, which is an early and sometimes only warning sign that baby's in trouble. If baby isn't moving, I should drink cold water or eat something sugary to get baby moving. False, false, false. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice, candy, etc. If a baby isn't moving like normal, parents should speak up to their provider right away. Babies kick less near the end of pregnancy. Again, no, 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 this is an important one. Many women believe that their baby should slow down or settle for birth, or they're running out of room, and that's why they slow down. And that's very dangerous in that term part of pregnancy where, or that late part of pregnancy where stillbirth risks increase. A living baby, just like you and I, is going to continue to move up through labor and even birth. So they might perceive the movements to feel different, but baby should still be moving. Triage doesn't need any count the kicks. Labor and delivery triage doesn't need any count the kicks education. False, it's the perfect place for this information because many times women will come in with concerns and be discharged, right? And so they need this information in their hands so they can learn to kick count and learn their baby's normal, so they'll know if and when they should return to labor and delivery. Finally, pregnant people should avoid dental care. This is actually false. And so good dental health is always important. We know that when you're pregnant, you're immunocompromised. And so actually your dental health is worse during pregnancy. So pregnancy can actually increase your risk of issues, thus impacting your overall health and your pregnancy health and your baby's health. So you do need to continue dental care, of course, working with your healthcare teams. Think systems change. Okay, what can you do? Each of you knows and understands the system you're working in. How can you, from top to bottom, infiltrate, implement, and make sure that these important conversations, this education is reaching the people that you serve? Can you add it to discharge paperwork? Do you have if you're in an OB clinic, for example, and someone calls in with a concern, you know, that person that answers the phone is like a gatekeeper, and they could put them into a call queue and not get a call back to them for 3 hours. That's too long. They need to know and understand how to get people directly to the nurse or doctor to have a conversation and or send them directly to labor and delivery triage. Can you include it in family care or intake forms if you're part of a nonprofit organization? Glucose testing is the perfect time. It's the beginning of that 3rd trimester. Perfect time to show them how to download the app and have that important educational conversation. Can you include it in your emergency or your electronic medical records or health records, making sure to have the conversation at every single touch point in the third trimester, not skipping that conversation, not even once in the third trimester. And could you add a Count the Kicks message? Please download third trimester, time to start counting. Please download the Count the Kicks app today. Could you do that in your phone recording? When you go on hold at a doctor's office, you hear many things, right? Just ideas. Here's an example of a hospital in Iowa that did add the Count the Kicks information to their discharge paperwork. And here is an example of a community-based organization in Columbus called Celebrate One, who serves at-risk individuals, and they have one touch point. So they included it in their intake form. Finally, resources. What's available for you? How do you get this information in your hands and then give it out to those that you serve? Well, first of all, our website, www.counttthekicks.org, is full of important information, evidence, stillbirth by the numbers, how to order materials, information on our volunteer and ambassador program, baby safe stories, but also a parent academy, walking them through a lot of this training and information, a provider academy, kick counting charts, free childbirth education plans, educational videos, baby safe videos, all those things can be found on our website. It's a great free resource that I encourage you to go to today. So I mentioned that we have volunteers all over the country, many of whom serve because they are passionate about preventing stillbirth because it's impacted them. They lost a baby to stillbirth, or perhaps they use Count the Kicks to save a baby. And we have a growing group of volunteers that are birth workers and doulas that are serving the most at-risk populations that are coming alongside our work. And they are highly trained, high-level volunteers that are boots on the ground in your area. And I have exciting news. It's not on a slide. Recently, like within the last 2 weeks, we've had ambassadors that were formerly in Ohio and South Carolina, two ladies that are already established with our organization, moved to the great state of Michigan. So more to come. They will be added to our website soon. One is in the Detroit area. And so we are excited to have volunteers, boots on the ground, that might be able to go to a baby fair, attend events, help give trainings or presentations like these, etc. In your state. So if you ever have wants, needs, potential for more partnership, it's important they let us know. So I'm almost done. I've got 2 minutes and then we'll do Q&A. Next steps, familiarize yourself with the Count the Kicks app. Practice, practice, practice. Order Count the Kicks materials at www.counttthekicks.org. So free brochures, free posters, all because of this amazing partnership with the Covenant Health and with the Thrive program. You can go right now, and I would love nothing more. In fact, you can get an Amazon gift card for simply going to our website, www.counttthekicks.org, clicking on Order Materials tab, going to the great state of Michigan, and clicking that, and then filling your cart with the posters. We encourage you to put posters across your clinic, in your community-based organizations, other places that intersect with individuals. If you order today, your name, and during this presentation, your name will be put in the drawing for the $25 gift card from Amazon. Please take the time to stop and do that. Obviously, if you want to wait till the presentation's over, you're welcome to do that, but I will be downloading that report in an hour after this presentation. So go order those materials. Brochures are an excellent tool. They provide the tips and education to expectant parents. Put those posters above the scales. We have a great baby safe story where she was weighed during her pregnancy, always saw the Count the Kicks poster. That's where she learned to download the app. It can be in libraries, community centers. Where can you spread these bright, empowering posters, brochures, app cards that are 100% free thanks to the partnership that I've mentioned? So we're so grateful for that. And why do we do this? We do this to get babies here safely. Because we're out of time, I'll share this link in the follow-up email so you can watch Dana's story of how she's connect with us. Go to Facebook, Instagram, Twitter, TikTok, and our amazing website. Even sign up for our newsletter so that you are informed about the work we're doing and up to date. We would love to have you share our information on social media and follow us, like, and comment. So we want to help save babies in Michigan with you. And I am so excited to have been here to share this information. I am here right now to answer any questions. that you may have. So I will stop sharing my slide and we will get to those questions. You can place those in the chat. So if you have any questions, this is a great time to ask those. I'm glad to answer those. The Provider Academy is free. So if you go to our website, you'll be able to go to the tab about providers and you can go down and it gives you lots of insight, ideas, free childbirth education plans, etc., are a part of those tools and resources. And we have evidence on our website as well. Great question. Lots of everything's free. We also have CE trainings that are free. I'll send a link in the follow-up email for continuing education trainings in the state of Michigan, 2.2 hours. You can take the CE training completely for free and get that information in a more depth about Count the Kicks and about our work to prevent the disparities. Thank you so much for coming. It's been such a pleasure. I'm here to answer more questions. I'll stick with you for a few more minutes. So glad that each of you is doing the great work that you're doing and thankful for your partnership. You're welcome. You're welcome. It's been an honor and a privilege. Again, I love the state of Michigan. If you weren't on at the beginning, it's my favorite place to vacation. We're up on Lakeside every summer. So I live in Iowa, but my heart's in Michigan in the summer. Glad to answer any other questions here. I'll stay on for another minute or two. Again, there will be an email that has this recording to this presentation. It will have a PDF of the PowerPoint slides. It will have live links to the CE training, how to order materials, everything that I can offer you, and that will be there by tomorrow, if not by the end of today, depending on the upload of a video. And I'm super excited to share that with everybody that's registered for this. So if you haven't ordered your Count the Kicks materials, I encourage you strongly to do so now. Put your name in the drawing for that Amazon gift card. Get those materials in the hands of expectant parents as quickly as possible. It takes us 10 days, 2 weeks at most to get those materials delivered to you once you order them on the website. Shipping's free. The materials are free. Everything's free, folks. The good news is these tools and resources have been provided to you. Please take them. Please share this campaign with those that weren't on here. Please offer other partnership opportunities. We're glad to do more presentations. Those are all ways that you can help spread this campaign and make that impact. We want to save those 25 babies in the 14 counties we're serving, and we want to save well over 100 babies in the state of Michigan statewide. So thank you so much. Thank you to our partners who have paid to have those materials for free. They have funded that and the CE trainings. And thank you for the opportunity to present today to Covenant Health and for the Thrive program. Well, if there are no further questions, I'm going to go ahead and hit stop. And thank you for your time. Have your eyes out for that email.